You know, Dr. Mwende, we had so many questions last week
Yes.
about dental health, and it just you just had to come back.
Yes, I
There
had
was
to.
there was no way around it because we didn't answer them,
Yes.
and we are held accountable. Tukikosa kujibu na sina tumesema watu waulize maswali.
Yes.
So kindly introduce yourself to the people who were not tuned in probably last week.
Okay. So my name is Dr. Mwende. I'm a dentist by profession. I'm also a graduate of Moi University, class of 2018. And today I'm just so excited to be here. We are going to talk about teeth. And I think it's an interesting discussion today. So, yeah.
Yeah, I'm looking forward to that. Are you ready to get into the questions?
Yes.
Okay, cool. So, where do we start? Hi, I'm Sylvia. I took my twins to dental care when they were 5 years.
Okay.
They didn't have any problems, and when I mentioned that to the on-duty officer, I was sent away. That haina haja. Now they are 7 years, and my drive to go for a routine check is almost dead. Also, could you talk about situation when a child is born with thrushes on the tongue that goes and comes back, coupled with bad smell? My girl is very beautiful, but this worries me a lot because she's been on medication hadi nimechoka.
Okay. So I'll start with the
Routine
issue where
check.
she was like, she went to the hospital and then she was taken back. I think that was not very right, because nowadays we're encouraging people to go to the dentist, at least to do prevention. Even if the child is not sick, we're able to give you, ways in which you can be able to take care of your teeth. And routine checks are very helpful. Like right now, she's already talking about a condition that is already setting in, which is basically about gum disease in children. And it's something that can be prevented. We usually say there's some bit of cleaning that we do to the children, which is less meticulous compared to the adults. We usually use some paste and also a powder. Then that one is very gentle on the gums, and it helps in the, just removing the plaque, because plaque is dirt that has accumulated over a few days, but the child is not able to remove very well.
Like,
So
how young is young for that cleanup to start?
from the age of 3, 4,
Okay.
once the child is able to take instructions in a way that they come to the clinic and I tell them, sit, from that age you're able to start the simple procedures. Even the first time, we actually don't do much. Just come to the clinic, we tell you this is the chair, this is the mirror, this is this, so that the child can be at ease. So from the very simple procedures, those ones will help the child to actually cope better in future. So at that time, I think the dentist would have just checked and given those simple procedures that children actually cope with. The other issue is the thrush.
Yes.
You will find that if the child is on medication, the normal flora in the mouth, it's a bit how do I call it? It's interfered with. Okay. So that kind of thrush could be either from the medication or basically just from the poor oral health. So cleaning, it helps a lot with that.
Okay.
Yeah.
What about the bad smell? Because that's she also mentions that my very beautiful girl has a bad smell, and she's worried because they've been taking medication hadi amechoka.
Yes, that's why I'm talking about the issue with gum disease and also the thrush.
So those two could actually lead to the bad smell.
It leads to very bad smell, and most of the
Did you
time
say
you'll
very?
most of the time you'll even realize that the gum is a bit swollen. Yeah, so most of it is to do with the gum disease.
Okay.
Yeah,
okay.
so we need to go to the dentist. We need to get checked up. We need to get cleaned, and there is also the dentist will also check the medication that she's checking, so that if they need to be changed, then they will be changed.
Okay.
Yeah.
Okay. Daktari, kindly elaborate more on the causes of brown teeth discoloration or dark stains on teeth.
Okay, I think that is very interesting. When it comes to discolorations, we usually classify them into two. Okay. We have the extrinsic ones and the intrinsic ones. The extrinsic ones, they are on the surface, just on the surface of your tooth. The intrinsic ones, they're actually inside your tooth, or it's part of your tooth. The simplest, which are actually the extrinsic ones, they come about probably due to just poor brushing, and then also taking lots of colored foodstuffs,
Okay.
even coffee, and even these food colorings that you put in food. So that kind of stain, it sticks to your tooth. And then there is some bit of chemical reaction, we call it ionization, and then now it sticks. So that one is actually just on the surface. It can either be brown or dark. Then the other staining on the surface is actually caused by gum disease, which we called the calculus last time.
Okay.
So those external ones, they are easily cleaned out by what we call scaling. The other intrinsic one now, we have fluorosis. Fluorosis is very common nowadays because people are usually, because of the borehole water in most rentals. So you'll find that in town, most people, their nini is changing. Their teeth color is changing, what you call fluorosis. It can be mild or even to severe cases. Mild is a bit just stains, spots on the teeth. Moderate will be a bit, it will cover a large surface of the tooth, and then severe will even change to dark. The other intrinsic stain can come from trauma to your teeth. You realize that maybe you fell or someone hit you, and then now that trauma went all the way to your tooth, inside the tooth, and then now that causes blood flow, issues with blood flow to your tooth. So with time, you start noticing either one tooth is just dark, where you got hit.
Okay.
So that one takes a bit of time, 5, 6, up to 10 years.
For it to show. Okay.
Yeah, and then...
So, sorry to cut you short. What happens when I find myself probably, like where I've grown up, ni Majiaboho. We went there when we were a bit older, so we never got it. Is there a certain age that is more susceptible to, getting the fluorosis? Because people who were born and raised there, mostly yao ilikuwa hivyo. So we joined the hood when we were a bit older, though we didn't drink the water a lot, but we used it to cook and stuff like that. Is it susceptible to a certain age?
Okay, fluorosis starts when you're young.
Okay.
Or even during pregnancy. So like if you're pregnant and you're living in a place where the water is salty, what you call high fluoride levels, your child will be born, the permanent teeth will actually have fluorosis, whether you move or not.
So if I am pregnant and this is the water I am drinking, then I have subjected my child to fluorosis?
Yes, you have. Even if you move after
even if I started drinking fresh water?
Yes.
Hata nikienda huko kwa milima?
Yes.
Oh my God.
Then the other thing is if you grew up in a place where the water was fresh and you moved to the area where there's salty water, you do not get fluorosis. Because by that time, your teeth have already matured and they've reached maturity. So,
is there a way to treat the water then, if that is the problem? We know very well that this hood will be a problem. This is the only kind of water we are having in our rentals nowadays. Is there a way to treat the water to just reduce the chances of getting fluorosis?
Unfortunately, for the to treat it for the community, you can't. But you can treat it from home. We have water filters that can actually filter the fluoride levels. Yes, but the stream and all that in the river, no.
We can't do that.
Yes,
but you can do it at home, so there's hope.
Yes, it can be done at home. Then the other thing is that it can actually be tested. We have labs that test the fluoride levels in the water. And then when you're made aware of that early enough, you can take the necessary precautions to avoid that.
Okay, okay. I think that's some, nowadays when we move to houses, no, Lisa, because borehole water will never run out.
Yes.
So we are more excited about that right now, not knowing what dangers we're causing to ourselves.
Yes.
But now there's also another thing where you see someone with really brown teeth.
Yes.
It actually looks like ukiguza, inaweza tokana, alafu mtu anasema hiyo meno yake ni kuoza, ama kengine ka black hivi, inakaa ni kama, so people watasema ni kuoza. Is kuoza a thing or not?
It is. Actually, as part of discoloration, there are people who get discoloration from cavities or caries. hizi za mbele, especially the front ones, you realize that in between you're starting to get some brown or dark spots, katikati. And that is how a cavity starts actually. It starts as a small brown tiny lesion that can actually progress. So also for discoloration, you might find that caries causes discoloration. Then the other thing, now the fluorosis, when it's a bit advanced, it's your tooth actually start looking weak. Ni kama zimeanza kuchip.
Yes.
I don't know if you've seen someone who has generalized fluorosis. Like the teeth are brown and then there are some parts that are very dark. So the teeth will actually look weaker than normal. Yes.
So, like sikuoza.
For fluorosis, no.
Okay.
It's
but
not
the
decay.
other one that has, you know, a bit of cavity.
So if your teeth are generally white or of good shade, and then you notice one that is turning brown or dark, that is a cavity. Chances are a cavity. But if your teeth are fluorosed, most of the times it may not be a cavity, because fluorosis, fluoride alone makes the tooth darker. So it may not be a cavity. But the problem with fluorosed teeth, once they get a cavity, it progresses very fast. And then you may not be able to notice until it's very deep, because teeth that have fluorosis, they are a bit stronger.
Really?
Yes, their teeth are actually stronger than for us without fluorosis. Yes, so you may get a cavity and then it takes time to develop, so that by the time you realize, it's very deep.
Dr. Mwende, you are educating us, Leo. Hi, Mikali. I had a problem with my teeth for so long. So far, I've lost 4 of them.
Okay.
Please ask Daktari whether low calcium levels could be the leading cause of this.
Yes. So, as dentists, the first thing that you pick when you have cavities is your oral hygiene and your practices in terms of oral hygiene. Are you brushing well? Are you neglecting your teeth? Because we usually grade the risk for caries per person. There are people who are more likely to get cavities and others are not likely to get cavities. Someone who is brushing very well. And then the other factor that we consider is actually in terms of formation of the enamel, because we have conditions that lead to poor enamel. We call them, there is
enamel ni part ya nje.
Hii part ya nje. Ile ngumu. Do you know actually the enamel is the hardest part of the body? It's even harder. It's harder than bone.
Oh.
Yes, it is harder than, it is the hardest part of the bone. So when you have a condition in the development of the enamel, we have a condition called amelogenesis imperfecta. And then we have another one called dentinogenesis imperfecta. In those conditions, you find that your enamel is a bit weaker.
Okay.
Yes. So in such a case, your teeth, they are more likely to break compared to someone who got enough calcium when developing. And in such a case, now we are able to tell you your teeth, even if you're brushing very well, they are more likely to break compared to someone who has just normal enamel. Wow. And people with that kind of condition, you find that their teeth, they're a bit brown, but it's not fluorosis.
Can we just stop right there?
Okay.
We're taking a very short commercial break. We'll pick it up from there. Dr. Mwende is still in the studio. Please send in your questions. 111-444-444-111. That is our SMS line, and we are all things dental health. Don't go too far. We're talking about dental health. This is Full Circle with Mwikali, and we have Dr. Mwende in studio who's answering all this. Daktari, I stopped you at the upper mahali ilikuwa imefika.
Weak teeth.
Yes.
So what I would say is that unless the dentist actually confirms that you have that condition, you should not be. You should not say that your teeth are weak and they're breaking. You should just brush very well. Visit the dentist so that we can be able to take care of the teeth that are already breaking, because the thing with decay, it progresses fast, and if you wait for long at home and then you go to the dentist, when it's too late, chances of losing that teeth are very high.
Very, very high.
Yeah, so we need to visit the dentist. We need to confirm if we have those developmental conditions of enamel, or if we don't have them. Yes.
Okay. Taking you back to the stained teeth, are there
Yes.
some home remedies for that? Mtu anasema siwezi enda hospitali.
Okay.
Ama sina hiyo pesa. What can I do at home
Okay.
to help myself or even my children?
Let me start with the remedies at the hospital first.
Okay.
In the hospital, if you have stained teeth and we confirm whether they are extrinsic or intrinsic, if it's extrinsic, we just do the normal cleaning.
Okay.
And the stains go away. That kind of cleaning, we call it scaling. It's supposed to be done at least once a year.
Okay.
Good for after every 6 months, it's good. So if it's just extrinsic staining, cleaning, proper brushing, and it's away. The other one, which is intrinsic staining, which you said there is fluorosis and other causes. Fluorosis we can manage by a wide range. We have whitening. We have what you call veneers.
What are those?
Whitening is about bleaching.
Okay.
And for bleaching, we usually do for very mild stains.
Okay.
If your fluorosis is just kidogo. Because bleaching is, we usually use bleaching agents that are a bit corrosive. And I wouldn't say they work, they don't go very deep. It's just on top. So if your fluorosis is kidogo, that one works. There's also another one that we call microabrasion. We just like scrub just on top of the stain and it goes away. So those are the two types of bleach. The first treatment that we do. If it's a bit deep, now for fluorosis that is a bit moderate to advanced, we change to veneers.
Okay.
Veneers, we have two types. We have the direct, what we call masking. This one we just do in the clinic. You come, I remove the upper part just to create space for the white material. We call it masking. So if you do this stained and it's brown, I just remove the upper part, then I put a white layer on top.
Okay.
Your smile changes to white. Okay.
Ah.
Yes, like you won't even notice because we do up to, when you smile,
Yes.
where it reaches,
Yes.
we do up to that level, all your teeth, so they become white. The other one that we do is veneers. Now veneers, we have the clinical part and the lab part.
Okay.
So this one is done in 2 stages. You have to come twice. The preparation is the same. We remove the upper part and then we take that, we call it an impression. We take to the lab and then they make a very thin white layer of, we call them, they are ceramics and composites. It's very white. So that layer, it's now brought back to me. And then when it comes back, I just cement it on your tooth, on the place where we...
Is that a permanent solution?
It is a permanent solution.
Okay.
The ones that are made in the lab, the ones, we call them indirect veneers. These ones, they serve you for long. They don't crack. But the one that we call masking, chances of it cracking with a few years, they're higher.
They're higher.
Yes.
Okay. Home
So,
remedies?
For the home remedies, I wouldn't recommend much.
Okay.
But there's some toothpaste that are, you'll find them in the supermarkets and also in the chemist. They have they have whitening content
Components.
inside. Mostly it's charcoal, but I wouldn't advise for someone with, stains that are already visible,
Okay.
because they may not come out. The other home remedy that actually we do in the clinic is you come, I make for you a tray, and then I give you a gel that you can actually put while you're at home, and then you can keep bleaching your teeth until you get the shade that you want.
Okay.
Yes.
Okay. So it's home, yes, but it is
It is-
advised from the hospital.
Yes, it works very well.
There's another thing about charcoal that you just mentioned. There are people who just go crush it. They wanna replace toothpaste na ile makaa.
Yes.
Alafu wana brush.
Yes.
Hiyo home remedy.
It is a bit messy. I wouldn't advise.
Okay.
It is messy, yes.
Okay.
Yes.
Hi Mwikali, say hi to the dentist. My question is, I have a tooth that has a very big cavity and sometimes the gum swells and the swelling is painful. What do I do?
What
do you do?
that tooth has an infection.
Yes.
So the cavity has been there for long. So when it is there for long, now food and bacteria, they seep in. And then the tooth has like a small volume inside. So once that bacteria and food, there's a lot of pressure inside. So that now infection tries to get out. Because there's no room for that.
Yes.
What the room that is in the tooth is just for the nerves. So when you introduce something else, it needs to get out. So that is how you get the infection, and most of the time the swelling is more of pus. So we usually recommend come to the dentist, get the proper treatment. The first thing that we do is usually put you on antibiotics to manage that infection, and then from there, if the tooth is in good shape, we can do our root canals, and then after that we do crowns to reshape your tooth.
Okay.
Yes.
Okay. Hi, Doc Mwende. I had a tooth cavity kwa molars uko. And last year I went to a dental clinic for checkup because I had begun to feel sensitivity 4 months before going to Hosi. I therefore did feeling.
Yes.
However, I feel pain sana kwa your tooth. Nikikunywa maji, I can't even chew using that side. What do I do?
Okay, so when you come to the clinic and then the tooth has a cavity, the sensitivity is there because the tooth is exposed. And then we usually check the depth of the cavity. For fillings, we usually do for cavities that are a bit shallow.
Okay.
And if the cavity is deep close to your nerves, most of the times we don't do a filling. We go direct to the root canal. Okay. If the filling is done close to the nerves, you may end up getting those kind of symptoms. You may get some sensitivity, some bit of pain, because the materials that we use for the fillings, they have some bit of acidity. So if that acidity now reacts with your nerves, you start getting more symptoms. Okay. So it's a matter of where is the cavity, how deep is it? Because you can't do fillings for cavities. There is levels.
Okay.
Yes.
Okay.
So the best advice is to go back, let it get checked. Most likely they'll have to do a root canal.
A root canal.
Yes.
Okay. Hi, Mikali. My 5-year-old had her milk teeth removed. Ati juu zinazuia permanent kumea vizuri. Yes, alikuwa anapata home. You know home?
Yes. Inside.
I don't know. Is there an English name for that for anybody who doesn't know what home is?
No, we just call them over-retained deciduous teeth.
I don't know. They call... But niliambiwa atatolewa hizo next atakam. Next akikam. Hazishake juu ya space. Is that how it should be? I don't want her to have problems.
There is a lot of science behind that, because you'll find that if the milk tooth is still there,
yes,
and the permanent one is coming out,
yeah,
the permanent one now will have to change direction to go occupy space elsewhere. You see now the child is 5, so most likely it's the lower, is zambele.
Yeah.
So kama hizo milk teeth hazijatoka, hiyo permanent itaingia ndani. So that's how you get the homing.
Oh, okay.
Yes, so in that case, we usually we remove the milk teeth.
Okay.
And then now, because the tongue is a muscle, you know, the tongue is actually a very powerful muscle. It pushes the homing forward to their right position.
Okay.
That happens if there is enough space for those homing. Because for some children, you find that the kajo is small.
Yes.
So there's not even enough space for the permanent ones. Now in that case, we usually do planned extractions, but we let the parent know that your child has a small jaw. So you may have issues with space. Okay? So the extractions are done in a way that we create space for some, but we sacrifice others. But by the time the child is older, by the time of 11 years old, because they don't have enough space. Now from that time, we usually start braces for that child, so that we are able now to start expanding the jaw and creating space for the teeth that are actually permanent and they don't have enough space. So it's something that can be managed.
Okay.
Yes.
So if the teeth, say for example, they have baby teeth over here.
Yes.
Na huku ndani kuna mea meno ingine.
Ile permanent.
Ile permanent.
Yes.
At an age where the permanent one should not be coming out.
No. The permanent one is always coming out at the right time.
Okay. So when it's all the way in here, the first remedy would be to remove the baby milk teeth.
The milk teeth.
And then hopefully the tongue will push it into the right direction.
Yes.
If that doesn't happen because of the small jaw, then extraction could happen.
Yes.
Or we wait later for
braces
Okay.
and alignment. Yes.
Mimi nimeshika, sijui kama umeshika. Hi Mwikali, please ask Daktari, how much toothpaste should one use?
It depends on age.
Ooh, okay.
So for adults, you just press the tube just once. And that, the amount that comes out, that's enough.
That's enough, okay.
For children, it's a different story. For kids below 3 years, you see, you just get the toothpaste. You don't even press. You just like run it on top of the toothbrush.
Okay.
It's just like a line. That kidogo, because children are not supposed to swallow toothpaste ever. It has a lot of fluoride. And that fluoride is what you are trying to avoid in children who are developing. Because if it's a lot, your child will get what? Fluorosis.
Ah, la, 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 la.
Yes. For children above 3 years, it should be a pea size. I don't know if you know the size of a pea.
Yeah.
Very little again.
Yeah.
At least that time, una press. But for adults, don't keep on pressing that tooth. It's a lot and you're wasting.
So, finya mara moja.
Just once.
Inatokelezea hapo,
You know,
hiyo
when
ndo
you put a
natumia.
lot of toothpaste,
Okay.
you'll not be able to brush well because you'll start getting what you call a gag reflex. Because your mouth will be full of that.
Foam.
And then gag reflex is a tendency to...
Feel like you want to vomit.
Yes. Yes. So you just need enough. Don't put a lot.
Okay.
Yes.
Mwikali na daktari, mimi meno yangu ni kubwa na nilipigwa x-ray nikaambiwa my jaw ni kidogo. So my last teeth hazijamea na zikitokea hazina place. So zinauma sana. What can I do, please?
So what happens, that kind of condition, we call it impacted teeth. Mostly it's on the wisdom. So with what we call what? Do we call it evolution or what? People nowadays are getting smaller jaws compared to our forefathers. So you realize that the wisdom, the one comes out the last, at the age of 18 years, it doesn't have enough space. So what happens, it doesn't come out, or it comes out kidogo. Now, it's better when it doesn't come out. Ikae tu uko.
Okay.
Because once it comes out kidogo, cavities, because you'll never be able to brush uko.
clean.
It's like iko submerged uko. So your toothbrush can't get there. So getting a cavity is very fast. Now when that cavity forms, because you realize most of the time that tooth is not even straight. It's a bit slanted. You will get that information from the x-ray. Even your dentist will show you this is how your tooth looks. Most of the times it's not straight, it's slanted. Other times it's looking at the back. It's crazy. They can be in very weird positions because they don't have enough space and they're trying to get space to come out. Now when you get that cavity, it becomes very uncomfortable because first of all, you don't even know why the tooth is not out. So you're still waiting. Daktari inatoka ama haitoki. Most of the times I talk because it doesn't have enough space. So it's not like his teeth are big. Just that the jaw didn't accommodate all the teeth because
So do we
of the
go
size.
and remove the meno yenye iko shapeless uko nyuma?
Yes, that is the only way. That is
Okay.
the only way because of the position.
Okay.
Yes.
Haya. Hello, Mwikali. I'm Fanny. Kindly ask Dr. Mwende, what can I use for tooth sensitivity?
Okay, now for tooth sensitivity, it will depend on the cause. You know, cavities, they're usually our number one suspect
Okay.
when your teeth are sensitive. The other issue is something we call attrition. Attrition is wearing out of your teeth. Comes about because of bruxism, grinding your teeth. So once you grind your teeth, there is a lot of loss of the enamel. You go down to your dentin. So it depends on the cause.
Okay.
If it's a cavity, it has to be filled. This issue of you have sensitivity and you're treating it from home with Sensodyne, it has to stop. Because you don't know what you're treating. Once you keep on using Sensodyne for long and you have a cavity, the cavity keeps on progressing. So by the time you come to the dentist, it's a bit bigger.
Okay.
And the treatment options usually change. So it depends on why are you actually having sensitive.
There's a question here about the prices of whitening and the veneers as well. So
Whitening, we usually do full mouth whitening up to your smile line. Most of the time it ranges from 25,000 to 30 for the for the bleaching, but it also depends on how many sessions you're taking.
Okay.
Because if you do many sessions, then the bleaching kit, we tend to use more kits, so
Okay.
that might increase the cost.
Okay.
But the minimum is 25,000. The veneers, it depends on the one that you're doing. Kama ni ile ya clinic yenye nakufanyia hapo, it's 5,000 per tooth. But if you're doing the one that we have to send to the lab, the stronger one,
Yes.
that one is 25,000 per tooth.
Okay.
Yes.
Part 2.
Yes.
Thank you for that. We have about 2 minutes. Hi, Mwikali. This is a whole class, I tell you. I agree with you. Hii ni darasa, and we are grateful, Daktari. 2 questions to Daktari. 1, can tooth loss be genetic? My grandpa and dad and uncles are all victims in that. They are all using artificial teeth.
Okay.
I think about it at times and just imagine I'm next. Question number 2, some people have one bluish tooth, which honestly I consider beautiful. What about it? So, tooth loss, is it genetic?
It's not genetic.
Okay.
The fact that she's talking about grandpas and, the older generation, this is mostly I think it is from gum disease.
Okay.
Because the thing with gum disease, people take it lightly, but it is difficult. I think it's the most difficult sector in dentistry to treat, because once it sets in, it advances, and then the teeth, it destroys the gum and the bone. So with that, your teeth become loose. Zinaanza tu kushake. Actually, utaona zingine tu zinaanguka zenyewe when you're eating. So that is advanced gum disease. Okay. So it's something that can be prevented. I would advise that viewer to just go to the dentist. These things are manageable when it's early.
Yes.
But once the tooth is shaky, we call it an hopeless tooth. It's a tooth that needs to go.
That's so true.
So it's not genetic. Yes, it's something.
The blue one, the beautiful one. What is that?
Now the
In like 30
Bluetooth,
seconds.
the Bluetooth is that discoloration that I was talking about, trauma.
Okay.
Because it only happens on the tooth that was traumatized.
Okay.
Ukianguka igongwe from inside,
So tuing'oe?
changes. No.
Iko tu
We do
sawa.
root canals,
Okay,
and then we
okay.
do crowns on top for it to be white.
Dr. Mwende, how can people get in touch with you? And thank you so much for coming through.
Karibu sana, I'll just give you the clinic number.
Yes, this is your camera.
Yes, 0765 000 006.
Okay.
I hope that's clear.
Do you want to say it again?
0765 000 006.
Asante sana.
Thank you so
Hii
much.
ilikuwa darasa yenye mimi nitapata A. Sijui
You will
wewe.
keep coming.
Kama unataka darasa nyingine, unaweza kiti tu daktari.
Oh, I'm still.
Yes. So kama unatafuta darasa nyingine ya huku kwa dunia to learn many other things, well, I'm here to tell you that Kids Technical College is one of the largest neck examination centers in Kenya. It's a premier tertiary institution established and mandated to operate by TVET authority. So when it comes to studying technical courses, I'm telling you, no one beats Kids College. They offer high quality technical and professional training to all who are aspiring to acquire and improve their skills that are relevant to the job market. And if you're even looking to get into entrepreneurship, well, this is the thing for you. They have ultra modern learning facilities, high qualified and experienced lecturers, attachment liaison office, counseling office. This all makes KEEP your preferred choice. So their intake is ongoing for full-time, evening and online classes. All you need to do is apply today and study with the best. Cape's Technical College, your sure path to success. We're taking a very short commercial break. We'll be right back. Don't go too far.